We're entering a critical time in Northeast Ohio related to the COVID-19 pandemic, and therefore we need your help to get these important messages out to the public. COVID-19 cases in our region and state continue to rise at alarming rates. Looking back to the start of the pandemic, much of the world was on a stay-at-home order. That is not what we face today. What we face is perhaps the most sobering situation during this pandemic. It is a turning point in the truest sense, and the power to do what is right is now in the hands of each member of every community. We know how to better treat this disease through innovative therapeutics. However, if we continue at the rate we are going, our hospitals will be overwhelmed. Across our region, we have enough beds and supplies to care for our patients. Our concern is our caregivers. We need everyone to do their part to protect the healthcare workforce as we navigate through this pandemic. Today, here at Cleveland Clinic, we have more than 450 patients hospitalized in our Northeast Ohio hospitals. We're averaging 60 new COVID-positive patients admissions per day. Never before have we had this many caregivers out of work sick, currently more than 800. Yet our communities need us now more than ever. In order to do this, we need everyone in our communities to do the right thing. Akram is going to share with you what MetroHealth system is experiencing and a few important reminders as we head into the holiday season.
In the past week, the number of calls to the free COVID hotlines are the highest we've received since March, which means a lot of people are getting exposed and are concerned. That and the increasing test positivity rates, which are now nearly 1 out of 4 people tested in our emergency rooms and clinics, have resulted in a dramatic increase in hospitalizations and the number of employees who are becoming infected. And this is just the start of the surge. This reminds me of my work in New York City during the height of the AIDS epidemic, where we learned that unprotected contact with one person means you are having unprotected contact with dozens of people you don't know. The same holds true with this virus. Your nephew comes over for a Thanksgiving dinner, but you're not just in contact with him, you're in contact with all the people he's been in contact with and all the people they were in contact with over the past 2 weeks. As for our healthcare workers, contact tracing shows us that they are not getting infected at work, but instead when they are out living their lives. And if we have many of our staff out because of exposure, while there's a large influx of COVID patients, we will not be able to provide the best care to everyone who needs it. So I'm asking you, everyone in the community, to be even more vigilant about washing hands, watching your distance, and wearing a mask. Look, there is a light at the end of this tunnel. Last week and this morning, we received very encouraging news about a vaccine. I am confident we will be immunizing people in early 2021. In the meantime, we need your help to stave off a crisis for a little while longer until the vaccine is available. Please stay vigilant and please stay protected.
I want to make sure that I echo that of my 2 colleagues, Tom and Akram, that University Hospitals is similarly experiencing changes with regards to our experience with COVID, much worse, nearly 100% worse, if you will, than we did during the first phase. And I think there's no doubt about it that the primary ingredient behind that is the ability for people to move around, get around, and gather into small groups. At UH, we have just about over 200 inpatients at this time spread amongst our 18 hospitals, and we're getting 25 to 30 new patients a day. We have just about 200 or so of our staff, our amazing staff, who are sidelined with the virus at this point. So obviously that challenges our ability to continually absorb more and more patients. But nevertheless, we feel confident with our colleagues that we will together be able to do this. I think it's important to recognize that despite the potential good news of a series of vaccines, one of which we're trialing here, that we need to realize that before this happens, before there is vaccines to the public, we have a bunch of crucial months over the holidays whereby people will be gathering. I think, make no mistake, I want to make sure people who are listening understand that we believe, and I think I speak for Tom and Akram, that we believe our hospitals are safe. Oftentimes caregivers are getting the virus through community spread, and our patients certainly who are coming to us are getting it through community spread rather than spreading at our facilities. We use the latest techniques to make sure that we are protecting our patients and our caregivers. Clearly, masks work. I want to make that very clear. Masks work. We want to dispel the myths, but I'm seeing things, and I think we're all seeing things. Sometimes people are not wearing masks, whether they be gatherings of people who don't normally work together or be together, whether it be at a restaurant or a gathering or at a gym. And we're also seeing people are not properly wearing masks. You're seeing the nose exposed. We have to encourage each other in the nicest way to rid ourselves of that habit. And when folks are getting together into large groups, I think at times there's a level of ease that comes with familiarity, but doesn't mean that the groups are indeed clean or clear of the virus, and thus we're seeing the spread. I think we need to work together to make sure that we are the educators and we help people make the right decisions. I agree wholeheartedly with Akram that unlike in March or April, the notion of there being a potential new way of preventing, if you will, the spread, that being a vaccine, was not even in the cards. And I am very happy that that is likely in the cards. And I agree with Akram and Tom in private conversations, but that should not be a reason to loosen our vigilance. Now is the time we need to work together to protect our caregivers, our workers, our friends, our family in helping eradicate this and get ready for some of the exciting things to come with vaccines and new therapeutics.